McConnell now wants to keep the confiscatory, draconian Obamacare taxes. It's amazing. How exactly does all this get us to a return of the doctor-patient relationship, not to mention lower costs? Joining me now from New York City, family physician and healthcare policy expert, Dr. Jonathan Vitale. Doctor, isn't that the bottom line here? Shouldn't we be viewing all of this healthcare stuff through the prism of returning the doctor-patient relationship and not trying to twist arms to get people to vote for something that stinks?
Yeah. Well, first of all, hi, Graham. Thanks for having me on. Look, every day I think this bill starts looking more like Obamacare Plus in some areas and Obamacare Light in other areas. I don't know that we're really going to get to a full repeal and replace, and that really hurts patients in the end, which is really all of us. You know, the CBO talks so much about this 22 million Americans who are going to be kicked off of their health insurance, which is inaccurate because most of those folks are going to voluntarily leave when they no longer have the mandate. Right. But what they're not talking about is the 75 million Americans who will be kicked off of their Medicaid once that collapses, because that's unsustainable. And it's really not even good health care in many different instances. So I don't know that we're going to get to a repeal and replace. I think the best hope we have at this point is the plan that that Senator Paul and Senator Sass have put forward to do repeal and replace as two separate bills, which I think may gain some traction. Because once you repeal those regulations of Obamacare, even if you just repeal the regulations, right, then you're going to really be able to make headway with making cheap insurance affordable. Okay. And that there is going to be the free market. The problem is they're not repealing the regulations. They're leaving many of the Obamacare regulations in place. That's number one. Number two, this idea of leaving this tax in place, you know, is unbelievable to me, because what the Republicans are doing are caving to the Democrats, number one, and number two, caving to the rhinos who are on the fence. They're trying to win these folks over, just trying to get the vote, trying to get the ball over the goal line without thinking about the big picture here. They're caving and buckling to people like Cory Booker, senator from New Jersey. Roll tape.
It is a gutting of Medicaid. And why? Why cut so deeply into Medicaid? Well, we see clearly that one of the significant reasons why, right in this bill, is to give tax cuts to pharmaceutical companies, tax cuts to insurance companies, and tax cuts to the wealthiest amongst us in this country.
Let's look at the tax that Mitch McConnell is proposing to keep with this new plan that they have, that they're proffering in the United States Senate. I call it a penalizing success tax, because that's what it is. It's a tax on, quote, wealthy people. 3.8% surtax on investment income also applies to interest and capital gains over $200,000. You know, if you're a couple, you're going to easily make over $200,000 if you have two decent jobs. A 0.9% payroll tax on incomes over $200,000 that also ostensibly funds Medicare. Okay, so this is anti-free market is what this is, to keep a tax like this in place. Not only is it anti-free market, but it punishes success.
Yes. No, it does. And the other thing about the taxes there, Graham, is if you look at it with all the subsidies that they want to give and all the tax credits and all the breaks in this insurance stabilization fund, which is essentially an insurance bailout, I mean, somebody's got to pay for it. So that's why they're keeping in these ridiculous taxes on the wealthy, which hurts jobs and hurts the economy and ultimately even hurts health care. Right. You know, so it's really sad. But I think that if we can figure out a way to do a repeal bill, which has the repealing of the taxes, repealing of the regulations, and Medicaid reform, most of the Republican senators would agree on that. And then we talk about a different bill for the subsidies and the spending, which would probably get bipartisan support with the moderate Republicans and the Democrats. Okay. I think we could finally make some progress.
But, Doctor, doesn't Medicaid reform have to include many things? But among others, through Obamacare, they raised the, quote, eligibility, right? The poverty level. Now you can go 138% above poverty level, which means a family of four qualifies for Medicaid making $90,000. That's not sustainable. That's right. The model is not sustainable.
Yeah. It is not sustainable. Medicaid is bursting at the seams. Keep in mind why Medicaid was put into place. It was put into place for the poorest Americans, for poor children, for pregnant women, for elderly who need it, and also for disabled. That was who it was meant to help. When Obamacare came around, it expanded Medicaid to include folks who really never should have been on it, and quite frankly, would be better served by other options, which would come into the marketplace if these regulations were repealed. And Medicaid is just not sustainable. You're absolutely right. A family of four who makes upwards of $90,000 a year at 138% above the poverty line should not be getting Medicaid. And Medicaid is a system that has a lot of fraud, waste, and abuse. It's not always good health care, and especially it's difficult for patients to see specialists under Medicaid. So, and there's better options.
There's a practical side to this as well. For example, you as a doctor, you don't have to necessarily, there's no mandate to accept Medicaid patients. And therefore, I would imagine it's already producing some kind of backlog, not unlike what we see at the VA, where people are probably waiting for medical advice and treatment.
Yeah, that's absolutely the case. I mean, not only is Medicaid a strain on the system, about 30% of doctors don't take Medicaid, but the other issue is that with Medicaid, it's just there's so much fraud, waste, and abuse that happens within Medicaid, and it's hard to get patients in to see specialists as well. So it's not really doing patients a service. You know, and I've taken care of patients in many different states on many different Medicaid plans, and every state varies. But it's really unsustainable, and there's better options out there for our patients.
Okay, what we need is something that includes a combination of tort reform, right, and insurance companies be able to cross state lines and sell their plans across state lines. I think you would also possibly throw in there this end to giving pharmaceuticals monopolies on certain kinds of drugs and allowing, again, some free market competition. That's what this all is about, is a free market competition. I was just talking about this the other day. That what is the solution here? If it's not government, it's got to be free market. That's kind of what this country is founded on.
That's right, and we're coming up on our 241st birthday, and this country was founded on those principles of freedom, of competition, of capitalism, of hard work, and we need to start pumping those values back into healthcare. You know, you mentioned all those things that Tom Price has mentioned that he's going to be able to change with these legislative changes that aren't really under the budget reform or that they're passing this Obamacare bill on, but this is going to help with things like increasing the number of doctors in this country. We have a doctor shortage, making it so that patients can buy insurance across state lines, and reducing the drug prices as well. These are things that can't easily be done under budget reconciliation, but that Tom Price is hopefully going to do later. So we haven't seen the whole story yet, and it's going to take a while.
Checks in the mail, I say to this. You know, how many times have you heard government promise they're going to do something down the road? Ronald Reagan, I think, heard that in the 1980s when Congress said they would secure the border. Bottom line is, you have to look at through this prism. Is this plan, is this legislation going to reduce costs? Is it going to reduce the cost of policies? Is it going to drive down the deductibles? I think the answer is clearly no. Doctor, thank you.